The title of this animated video is The Clinical Significance of Embrasure Space Anatomy. Now, there are two types of embrasure space. There's a gingival embrasure space, but also there's an incisal embrasure space that we will talk about as well. This is a very interesting image. This is taken from a textbook that was printed approximately 100 years ago. And it's basically correct with a few slight modifications. They realized back then that the length of an unworn central incisor was approximately 11 millimeters. But we now know if we want to have a very pleasing emergence profile, yes, it's 11 millimeters on the distal, but it's only 10.5 on the mesial. And this has a much more aesthetic presentation. What is interesting, if you ask most people which is the longer tooth, a central or a canine, everyone would say the canine. But in reality, the canine and the unworn central incisor and unworn canine are both 11 millimeters long. So if we draw a line from the gingival margin of the central incisor to the gingival margin of the canine, you will note that they're exactly on the same plane. And interestingly enough, if you draw a line from the incisal edge of the central to the canine, that is on the same plane as well. So therefore, a canine is 11 millimeters long as well. But let's look at the lateral incisor. First of all, the lateral incisor gingival margin is 1 millimeter incisal to the gingival margin of the central and the canine. And this is misdrawn down here, but it is 1 millimeter short of the plane between the incisal edge of the central and the canine. So therefore, a lateral incisor should be 9 millimeters long. And if you will look, the premolars and the mesial buccal cusp of the first molar are 9 millimeters long as well. So it's very easy to remember 9/11 based on the tragedy this country experienced. Now think about the first molar. The first molar, the mesial buccal cusp, is part of the aesthetic presentation. But the tooth is torqued so that the second molar is over the ridge, and therefore the distal buccal cusp of the first molar is not part of the aesthetic triangle. Here we see the gingival embrasure space, and here we see the incisal embrasure space. And you will notice that the embrasure space, the incisal embrasure space between the central incisors is shallower and narrower than the embrasure space between the central and the lateral, and is even wider and more apical between the lateral and the canine. Therefore, the contact points similarly move apical because of the contours of those teeth. Now, we know that Tarnow has told us from the crest of the bone to the tip of the papilla in the normal situation is 5 millimeters. Therefore, you show no dark triangle, or you show nothing between the lateral and the central and a lateral and a canine. But if you will note here on the central incisor, because the contact point is so far incisal, typically there is a little, what I call an aesthetic enhancer between the central incisors. And if that is obliterated with a restoration, it gives an abnormal anatomy to the central incisors and is very aesthetic and gives them with crowns that I refer to as having a prosthetic look. Now let's look at an actual case, and you will see the pre-op on the left where we did crown lengthening and the post-op crown lengthening on the right. So let's look at the right slide. Notice that the embrasure space, gingival embrasure space between the central incisors, there is that little slight aesthetic enhancer that I mentioned. And if that's obliterated, then you have, as I call it, the prosthetic look, which is unaesthetic. The central incisors are 11 millimeters long on the distal, and 10.5 on the mesial to give the emergence profile that we talked about earlier. If you look at the gingival margin of the central incisor and draw a line to the canine, you will see that the lateral incisor, the gingival margin is 1 millimeter incisal to that. You'll notice that the lateral incisor is 1 millimeter off the plane. And if you notice, this is on a young patient with no wear, and the line drawn between the incisal edge of the central and the canine, it will be parallel to that apical line, which means that the central incisor and the canine basically are going to be 11 millimeters long. And if you look on the pre-op and on the buccal corridor and the post-op, where we have the teeth that are 9 millimeters long, and you need to have depth of smile on that. Notice that the embrasure space between the central incisor, this is a female, and typically you have a well-defined incisal embrasure space on a female. Often that is almost obliterated on the male, and you will notice as it moves distally that incisal embrasure space moves apically and gets wider, which means the contact point is going to remove apical. So here we see clinically what we've talked about on the other slide, and you will notice that we have a nice aesthetic presentation. Now let's talk about the clinical impact of over-contoured crowns. And here we see the embrasure space in 2 dimensions. And if we come down vertically 5 millimeters, you can see where these oversized crowns are partially obliterating the embrasure space, both vertically and horizontally. And so therefore, the normal 2-dimensional embrasure space between maxillary central incisors is 5 millimeters by 3 millimeters. But let's talk about it in a 3-dimensional view. In the maxillary arch, we've got 3 millimeters horizontal, we have 5 millimeters vertically, and if we go palatally or buccally, it probably goes 2 millimeters. So therefore, the embrasure space dimension in 3 dimensions is 30 cubic centimeters. In the mandibular arch, I think typically horizontally we only have about 1.5 millimeters, but we still have the 5 millimeter vertical dimension. And I think this is even less space from buccal to lingual in the maxillary arch. So I think the cubic millimeters in the mandibular arch is only a little over 11 millimeters. So let's look at that again. Here we see it has been reflected, the flap has been reflected, and we can see we're probing to the bone, and yes, the papilla comes down 5 millimeters. But as we showed you earlier, this 5 millimeter dimension, but we can see how these oversized crowns are obliterating to some degree in a lateral dimension and need to be reduced. So how we do that? Let's take a fine diamond and we go in there and contour as you see here. And if you look at the cemento enamel junction on a maxillary central incisor, not only is it arcuate, but also there's a little concavity. So the papilla that comes down is not straight line, it's sort of bulbous. And for those of you that are older, it has what I refer to as a Pillsbury boy look to it. It's sort of rounded as the papilla goes into that concavity, and that needs to be recreated as well when we do our reshaping here. So here we can see after the reshaping is done, and we can see the concavity present that we talked about on the mesial of that canine. You can see how we've opened up that embrasure space so the papilla can come back normally, as we will show you on a later case. So here we see it contoured, and here we see the flap replaced, and we're probing the 5 millimeters that we talked about earlier. Same thing is true on the central incisors. Notice how the embrasure space has been obliterated on the left with the over-contoured crowns, and then we see how this has been opened up, and let's see how that's going to turn out. So this is the way it looks pre-sutured, and this is the way it looks after suturing. But very importantly, this is the pre-op view, and this is post-surgery, and we can see how much anatomical change has been made by our surgery and reshaping those over-contoured crowns. So this is the way it looks sutured, and this is the way it looks 3 weeks later, and you can see we do have that little aesthetic enhancer between the central incisors that really defines those central incisors. And this is our pre-op view and our 3-week post-op view, and we can see that we do have a healthy situation. Yes, ideally, we would like to have highly polished margins up there, but in a clinical situation where crowns have been done, the patient is paid a fee of $1,000 or more for each of the crowns. Simply contouring them may help make the referring dentist look better, and certainly is not a wrong compromise to make. But we've talked about the impact of the distance between the contact points on the central incisor in the classic article by Tarnow. Now, this is very important. When the crest of the bone is 5 millimeters or less from the contact point, the papilla fills the embrasure space 98% of the time. This is what Tarnow found. However, this is only true if the distance between the adjacent teeth is 3 millimeters or less. And let's talk a little further about that. For every millimeter, the horizontal distance is greater than 3 millimeters, the tip of the papilla will only come down 1 millimeter apical. So, if the distance is 4 millimeters across rather than 3, the papilla will only come down 4 millimeters. If the distance between the two adjacent teeth is 5 millimeters, the papilla will only come down 3 millimeters. And if the distance is 6 millimeters or greater, then you will have no papilla. So let's look at this case on a 16-year-old girl where we're going to go in there and actually remove the papilla. And you can see on the right where the crest of the bone is 5 millimeters from the contact point. The distance between the two teeth at the bone level is 3 millimeters or less. And Tarnow says, and we found out he was correct, that this papilla will come back completely. And here we see the black triangle that we created the day of surgery. And here we see a 3-week post-op, and as Tarnow has told us, the papilla has come down completely. And the reason being on that is that the distance between the adjacent teeth is 3 millimeters or less, so therefore the papilla will come down 5 millimeters. And because this is between a central and a lateral with a contact point in the middle third, that papilla will completely fill the embrasure space. So here's the pre-treatment view of this young lady and the post-treatment view after we have finished the case, and you will see that the papilla has completely come down on that lateral incisor. So let's review about embrasure space in a three-dimensional view. What we're saying, the distance between the two teeth ideally should be 3 millimeters. And from the crest of the bone should be, the papilla is going to come down 5 millimeters on that. And we're going to guesstimate that the distance from the buccal lingual dimension is 2 millimeters. So therefore, there are 30 cubic millimeters of embrasure space. And it has the Pillsbury-Doughboy impact that it fits into the concavity on the distal of the canine, for instance, and the lateral incisor. However, in the mandibular arch, the horizontal distance is generally quite less, and let's say 1.5 millimeters, but the 5 millimeter vertical rule applies. And in a buccal lingual, I don't think that is as much as it is in the maxillary arch, and we're going to guesstimate that at 1.5. So the papilla space in the mandibular arch is markedly different in the maxillary arch, only a little over 11 cubic millimeters. And with teeth overlapping, that dimension should be less. So hopefully we have given you a good overview of embrasure anatomy, how crowns should be contoured so you get the most aesthetic impact on that. And hopefully this will help you in correcting cases where oversized crowns have been done and help avoid having the crowns completely redone.